Good morning, this is Dr. Mandy Kirk at Move to Success Physical Therapy. I know I haven't made videos in quite a while, but the clinic has gotten busy. The reason I'm making a video today is because I've had numerous patients ask me questions about torticollis recently, and I wanted to do a video about torticollis in infants just to kind of give people some ideas of how to treat this and how to work with their babies on this. So first of all, what is torticollis? Torticollis is a tightness of this muscle right here. It's called the sternocleidomastoid. It attaches right up here, you can feel it behind your ear, and goes right down here to your clavicle. So this happens often in the womb just based on baby positioning. When they come out, it could be because of just a preference that they have after they're born. So what you'll typically see is a tilt one direction. So a tilt is bringing ear down to shoulder, and then a rotation the opposite direction. So this is kind of how they would present normally. Sometimes you'll see one more than the other. You might see the tilt more than the rotation. You might see the rotation more than the tilt. Recently I've had a couple moms say, my baby always looks this direction, or they never look the opposite direction. So that's probably more of a rotation component than a tilt component, but they probably have both just based on the way that the muscle tightens. So torticollis is named after the tilt. So if your baby tilts to the left and rotates to the right, then they would have left-sided torticollis. If your baby tilts to the right and rotates to the left, they would have right-sided torticollis. So how do we combat this? What are some exercises that we can do to help? One of my favorites, and the first one that I always give to parents when they come into the clinic, this is my little baby doll demonstration, is called the football carry. So the football carry deals with the tilt component more than rotation. So you're going to place baby on your chest, facing out towards the world. You're going to put one hand kind of in between their legs, give them good support here. Hand rests on shoulder, opposite arm. So right in the crook of this arm is going to go onto the side of the baby's head, creating space in that neck joint. So we're tilting the head up this direction, creating an opening here. So if I'm placing baby on my left arm, that means that baby is tilting towards the left, and we're trying to get them to tilt more towards the right, open the side up, okay? So if baby has right-sided torticollis, you're going to do the opposite. So you're going to place baby on right arm and help to create that space this direction. So that is football carry. And then the other exercise I usually give first thing to parents is just a rotation stretch, just a gentle rotation stretch. So every time you do diaper change, which I'm sure is like 10 to 12 times a day with newborns and infants, you're just going to turn baby's head towards the opposite direction of the way they normally turn. So let's say that they normally are looking to the right. You're going to turn their head towards the left, and then you're going to hold that shoulder down so that they don't cheat by popping that shoulder up to try to not rotate as much on their neck. So you're going to hold that, count to 10, and then release, and then you can continue with your diaper change. So that one, kiddos don't tend to like that one very much. They don't like to have their head rotated in a way that they're not comfortable with. They don't like people touching their ears. But just keep in mind that you're only counting to 10, and then you're continuing with your diaper change. If baby's a little bit older and they have a little bit better sitting balance, then I typically do some exercises with the ball. So I'll get the exercise ball out. Oh, this is a little low. I'm going to get my taller one. So I'll get my exercise ball out, place baby on, and work on tilting side to side. So if baby prefers to tilt towards the left, then I would sit them down and then kind of tilt them over towards the left. The reason why I'm doing this is because babies are always going to want to try to find that midline, so they're going to pull their head back the opposite direction, more towards the center, and create that space in that neck. So you're stretching out the left side of the neck when you tilt them towards the left, and you're actually strengthening the right side. So this is important because we want to balance. we take kind of a multi-pronged approach with torticollis, where we want to lengthen or stretch the side that's tight, but we also want to strengthen the opposite side, because we want to give baby a really good sense of where midline is. This is important because the older they get, if they continue to have residual torticollis symptoms, they're going to think that their midline is maybe here, right? So this is a problem, because even if their neck is strong enough on the opposite side and the muscle is lengthened enough on the tight side, that they're going to prefer to be here because that's where they think their world is. So we need to try to correct this for midline as soon as we can. Strengthen on the weaker side, stretch on the tighter side, whichever side that may be. So just to review, if baby has enough neck control, is old enough to be able to hold their head up, you can support them at their waist on an exercise ball. If they're tight on the left side, you're going to kind of tilt them over to the left, allow them to pull their head up towards the right. If they're tight on the right side, so if it's right-sided torticollis, they have the right tilt, you're going to tilt them over towards the right, and they're going to naturally pull their head up towards the left, okay? Another variation that I like to bring up as kiddos get a little bit stronger and they can hold their own head up is I'll do that football carry position again here, but I'll kind of drop my arm for 10 seconds at a time and allow them to then support their neck. They're going to pull their head up towards that opposite side. So that's working a little more on the strengthening component than it is on the stretching component, but it's awesome for both. And then I want to do one more exercise for you guys to see. So this one's for little infants, is placing baby. I'm going to turn so you can kind of see. Placing baby in between your knees. Now this is important because it gives them that semblance of midline, right? Because their head is directly between your knees and you're keeping it straight up and down. And then you can add in a little bit of a rotation stretch by dropping one knee so their head tilts to the side, and then dropping the other side. So that's a really good one too. So finally, I want to kind of go over what could happen if torticollis is not addressed. So let's say that baby gets older, they were never treated for torticollis, they never did any stretches, they kind of maintain this position all the time. You might see some gross motor asymmetries. So kiddos with torticollis tend to only want to roll over one side, both back to front and front to back, because it's difficult for them to get momentum going the opposite direction because they're not able to whip their head. So babies use their head a lot to be able to roll, so they won't be able to use their head as much to the one side to roll. So you'll see asymmetries on directions that they roll. You might see asymmetry in how much they're pushing up on tummy time on one side versus the other, because again, they have that head tilted over to one side, so they might have a preference on which arm they're pushing through and which arm they're lifting with when they start to reach for toys. So as a PT, I like to see symmetry. I think it's really important to have that balance and equal strength on both sides. So this is why we want to treat torticollis earlier rather than later, so that we can make sure that we have balance in their strength on each side, and also that we don't end up here having our midline be here instead of here. And then as kiddos get even older, I might see some discrepancies in crawling if they had torticollis. So like I might see that tripod crawl where they put that one leg out and the other leg is bent, or they rest on one elbow and one hand. So that's really leaning over towards one side. So yeah, that's my video about torticollis. If you have any questions, feel free to reach out, comment, and then if you have any other videos that you'd like to see from me, I'd love to hear about it. So feel free to leave any comments about that, and I will definitely respond. And yeah, like, subscribe, and all that fun stuff. Thank you so much. Bye-bye.